As a childhood cancer survivor himself, his personal journey has inspired his career to improve cancer control care through research, mentorship, advocacy, and clinical trials. He aspires to specialize in internal medicine, followed by medical oncology and hematology, serving patients across sub-Saharan Africa. With his professionalism and engaging style, we are in excellent hands in proceeding with today's seminar. Without further ado, I would like for the Sangha to welcome Dr. Pavan Singh Chana with a warm round of applause.
Thank you for the warm welcome. Distinguished members of the Guru Nanak Medical Plan Committee, respected leaders, honored speakers from the SGBP Hospital, the CSI and GA Insurance, ladies and gentlemen, Sat Sri Akal, good morning and welcome. It is both an honor to be your MC and or Masters of Ceremony today. As you've heard, my name is Dr. Pavan Singh Chana, a medical doctor at the Aga Khan University Hospital, Nairobi, where I work in the Oncology and Clinical Trials Unit. Beyond medicine, as you've heard, I'm also a cancer survivor and also have been a caregiver. These experiences have taught me something more than any textbook that I could ever teach, and that's healthcare is far more about treating a disease. It's about preserving dignity, empowering families, and helping people make informed decisions during life's most difficult and critical moments. I learned that every patient deserves three things. That is timely and comprehensive information to make informed decisions, access to quality and accessible, affordable healthcare, and thirdly, the drug called hope. So today's program is about strengthening all those three, and whether your healthcare journey lies here in Kenya, where efforts are being done to enhance care here, or whether the route takes you internationally, we want to have information that will help us make those decisions. And this is the efforts that are being made by the organizers that they'll talk more about. And this whole conversation is about that. So thank you. I would now ask you to all rise so we can shortly play the national anthem and also the Khalsa anthem. So please be standing for that. So we'll start with the Kenyan national anthem. And then we'll go to our Khalsa anthem. Just briefly, and I think the first stanza. Thank you. You can now be seated. So, once again, I would like to welcome you all and our distinguished speakers. Taking a Sunday morning off from resting means a lot, and we acknowledge that. And hopefully this conversation helps you, because I don't think there's anything more important than health. Through my short experience, I've learned one thing, that despite any resources, any pleasures and wants we have, the most important thing we can have as individuals and even for our family is health, and that truly is wealth. So coming into such conversations to enhance that can do wonders and can take us far. So with that, that's what the conversation is going to be about for today. And without further ado, I would like to now invite the chairman for the Nanak Medical Plan to start the program before we have the speakers. Thank you. So please give a warm welcome to Mr. Sami.
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Empower your health and secure your future. Respected President, esteemed members of the Governing Council and Board of Trustees, distinguished guests, speakers, honored dignitaries, valued partners, ladies and gentlemen, with all protocols observed. Good morning to you all. It gives me great pleasure to extend a very warm welcome to each one of you. It's both a privilege and a pleasure to welcome you to this important health awareness event. Empower your health and secure your future. Being held today at the Gurudwara Sahib Pangani, Nairobi. The purpose of today's program is to provide valuable insight and practical information that will empower each of us to make informed decisions regarding our health, well-being, and future medical needs. Health is undoubtedly one of our most precious assets. However, many serious medical conditions can be prevented, effectively managed, or successfully treated through early detection, proper planning, and timely access to quality healthcare. Today's event brings together experts from healthcare, insurance, medical travel, and emergency medical services sectors to share their knowledge, expertise, and solutions available to support our healthcare journey. Over the next few hours, we will have the privilege of hearing from representatives of SGVP Hospital, insurance professionals, medical travel specialties, emergency response expert and healthcare providers. They will provide valuable insight into preventive healthcare, advanced treatment options, overseas medical services, insurance coverage, travel facilitation, and medical evacuation support. This program also presents an excellent opportunity to all attendees to ask questions, seek professional advice, and gain a deeper understanding of the healthcare resources and services available to you and to your families. I encourage everyone to actively participate in discussions and make full use of the interactive session and consultation desk that have been arranged for your benefit. On behalf of the organizers, I would like to express our sincere gratitude to all our guest speakers, valued partners, sponsors, and the management of the Gurudwara Sahib Pangani, Nairobi, for their unwavering support and commitment in making this initiative possible. Your contribution played a vital role in helping us bring meaningful healthcare, education, and awareness to our community. As we gather here today, let us embrace this opportunity to learn, share experiences, and take proactive steps towards healthier, safer, and more secure future for ourselves and our loved ones. Thank you all for your presence and participation. Thank you all for your presence and participation. I wish you an engaging, informative, and highly productive sessions. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.
So thank you, Chairman. So now we begin our session. So the reality of medical and surgical conditions is their unpredictability. Apart from that, illnesses can affect anyone at any stage of their life, often without warning. And the progression of these conditions can also be unpredictable and also be outcomes. So healthcare, at the same time, as much as healthcare is advancing at a rapid rate, with diseases once thought untreatable, now having various treatments, both pharmacological and non-pharmacological, surgeries advancing with even being minimally invasive, robotics, even AI helping. The remarkable advances comes with a challenge, and that's that navigating what options work best is the predicament. So patients and families often ask several questions, but the most common questions they ask is, when they get unwell, is which hospital is best suited for my condition? Apart from that, they also ask, should I seek treatment locally or should I go internationally? When is the appropriate time to be referred internationally? How do I prepare financially for the unexpected healthcare costs? And also, how do I get access to the right specialist at the right time? So we aim to address some of these questions, and our goal today is not to suggest that one health system is better than the other. Kenya, as I can attest, is making remarkable strides in delivering high quality, specialized healthcare for many conditions right here at our doorsteps. At the same time, certain highly specialized procedures or treatments do require international referral. So this morning, one of the hospitals from India, Ahmedabad SGPP Hospital, provides an example of that. It was a well-chosen hospital by the committee to see that care can be streamlined and coordinated when the international referral is needed, and that highly specialized care with specialists can be given. So I would like to give a warm welcome to SGPP Hospital. This morning we have 3 specialists, but we also have someone who can speak on behalf of the hospital. So I'd like to welcome Mr. Sagar to start that. Thank you.
Hello, Namaste. My name is Sagar and I am taking care of business development department at SGVP Holistic Hospital. So basically we are from India, Ahmedabad city and SGVP Holistic Hospital. So let me introduce about and give the brief introduction about our hospital. So it is allopathy, Ayurveda and yoga. So it is like a fusion of modern and traditional healthcare. This is our campus located at SGVP on SG Highway. It is a SGVP campus. And the institute is run by Sri Swaminarayan Gurukul Viswavidya Pratisthana. So Madhupriya Swami is the president Swamiji of the entire campus and the Balakrishna Dasji Swami is the vice president of the campus. And this hospital is inaugurated in 2017 by our Honorable Prime Minister Sri Narendra Modi ji. And like the fusion of modern and traditional healthcare, so leading the world to a healthier future by advancing health and wellness through a holistic and integrated approach. So that's why we are a holistic hospital. And it is a like 200 bedded multi super speciality hospital having the NABH accreditations in allopathy, Ayurveda and yoga. So we have a sub-specialty like neurology, cardiology, orthopedic surgery, pediatrics, critical care, and in the radiology wing we have MRI, CT scan, all the facilities we have under one roof. Yes, we have NABH accreditation in allopathy and Ayurveda along with the Guinness World Record. This is the infrastructure about the hospital, so 200 beds, ultra-modern operation theatres, cath lab, surgical and medical ICU, the comprehensive health checkup plans, and we of course have a teleconsultation. So whenever the patients wants to connect with our doctors, so we have the facility teleconsultations. And traditional healthcare we have a 20 Panchkarma theatres, like where we can perform the Ayurveda Panchkarma therapies and the yoga sessions and the renowned Ayurveda and Vaidyas team. So this is the entire scope of our services. So basically we have arthroscopy surgeries, like we do bariatric surgery, we do heart surgeries, we do neurosurgeries, orthopedic surgeries, infectious patients. So these are the scope of the hospital. And these are the department that the center of excellence of the hospitals. So we are the Gujarat first neuromodulation department. So we have a talk on this today. And we have a Vatsalya department, medical and surgical gastroenterology department. We do robotic knee and hip replacement surgery. And the comprehensive care and cardiology and cardiac surgery. Yes, as I mentioned, we are the Gujarat first neuromodulations specialty, and we do robotic knee replacement as well. And we have a 35 bedded pediatric dedicated unit where we can treat this all kind of super specialty under one roof. That is start from the neonatology, intensive pediatric care, general surgery. This is all about the pediatric only, like from age 0 to 14 or 16 years. And this is the key facility of the Vatsalya department. So 35 bed, dedicated 35 bed, state-of-the-art operation theatre, and pediatric cancer and chemotherapy we do, dialysis, physiotherapy, child development center, speech therapy and hearing assessment. And yes, in this department we also have that teleconsultation services. So this is the room facilities, like the infrastructure. Those we have the semi-special room, deluxe room, super deluxe room, premier deluxe room, and suite room. Depend on the class, whatever class you choose. And we have annual health checkups plan. So different like 10 to 12 different health checkup packages. So depend on your like the what we can say, like whatever. If you are diabetic, then we have a different profile for the diabetic people. This is the traditional healthcare Ayurveda Panchkarma room setup. So Guinness World Record performing 1120 Sirodhara therapy at a time. And the scope of our traditional healthcare Ayurveda department, that is, we do the Nadi Parikshan. If you heard about the pulse diagnosis by the pulse, and the Panchkarma, we do the Virechan Karma, that is basically for the detoxifications, and the Basti, Vamana, Raktamokshana, Nasya. So these all are the speciality of our Ayurveda department. Yes, so this is more about the Panchkarma. And we have that facility for the wellness. So we have 7 days, 10 days, 14 days, and 1 month wellness plan. So you have to come there. We have that indoor facility as well. So you can stay there and enjoy the, like as you say, the campus is very beautiful, like the big campus having the gracious gardens and all. So you can spare few days there. And this is our yoga hall, 1800 square feet yoga hall. So where the patients and the relatives can do the meditations, yoga, and all kind of yoga they perform there. So we treat you like our own. So you feel like your family treating at the hospital. So this is my contact number, is also having the docket. So I'm taking care of all our international patients, from airport pickup to airport drop, appointments booking, their accommodations, their food, everything. So we have a dedicated team who manage the entire international desk. So yes, so more about Mr. Jasraj, I think mentioned about our tie-ups and all. So thank you so much for that. Thank you.
So thank you, Mr. Sagar, for that overview of the hospital and for highlighting the services and yeah, the services present at the hospital. I would now like to welcome his namesake, Dr. Sagar Betai. He's a neurologist and he's currently the director of the Department of Neurosciences and head of Division of Neuromodulation at the hospital. With over 14 years of experience, he will discuss different neurological conditions with advances to neuromodulation. So please help me warmly welcome with a round of applause Dr. Sagar.
Sat Sri Akal. I am very happy and very humbled to receive such warm treatment, such warm welcome from all of you present here. Although we are meeting for the first time, but it doesn't feel like. So I'm very grateful and so I'll try to add some value to what you already know about our brain and the disorders related to the brain. So, and a glimpse into what we do at Neuroscience Department of SGVP Hospital. We have all sorts of treatment, but I will try to highlight one of the niche things which are more complex and more difficult to treat. And the treatment facilities are, I'm sure, not so much available in Kenya, as well as in many parts of India. So this is quite niche even for Indian healthcare and not just in Kenya. So what does neuroscience or neurology deals with? So in simple words, it's the disorders of the brain, our spinal cord, our peripheral nerves, which lead to many sort of symptoms which I'll be discussing in the further slides. So the nutshell of that being tumors of brain and spine. It can be epilepsy, so fits, जो कहते हैं मिर्गी. It can be Parkinson disease, which I'll be showing you in some detail in future slides, and brain hemorrhage, aneurysms. It can be spinal cord disorders like nerve compression, traumatic injury of brain and spine, and even in pediatric department, as Mr. Sahib Pangani already told you, we have pediatric neurology having one of the specialties as well. So we have separate clinics for Parkinson disease, tremor, dystonia, epilepsy, and pain management. And so a glimpse into what Parkinson is. So how many of you may be aware of what may be Parkinson disease? Can please raise your hand so that I have a feel of if you have heard about it or not. Some of you, okay. So basically जो simple शब्दों में कहूँ तो उम्र के साथ थोड़े धीमे हो गए हैं, ऐसा लगता है कभी कभी, कंपन थोड़ी होती है, right? But we attribute that to age. But not everybody who ages has slow gait, slow movements and tremor. Only some of the people have it, right? Especially if it is progressive. मतलब कि अभी जितना कंपन है, जितनी धीमापन है, वो 6 महीने बाद और बढ़ गई, 1 साल बाद और बढ़ गई. That is something which is not usual, right? So it's like aging faster than your age. So that's not normal. So this has to be addressed, and some of these people may be having Parkinson's disease. So kadam chote ho jate hain. I'll show you a few videos so you can relate better to it. So this is a simple example, and coincidentally this person is from Nairobi itself. So you can see the baby steps. And in the right side of the video, you see he's stiff. The hands are not moving freely, the steps are small, his walking is slow, and when he takes the medicines for treatment of this disease, he has a side effect in the form of these funny movements. So the right leg comes in front of the left leg. It's a very funny movement, and then the person trips because he cannot, get his steps in place, and it trips and has frequent falls. So this is something about Parkinson's disease. And by the way, once a person has advanced disease, even medicines don't help much. So the treatments are very difficult all across the globe. So we did something called radiofrequency ablation, which is like a single hole being made in the head, and a small wire goes in, and a person is completely awake at that time, and they get improved real time. So basically जो circuits काम नहीं करती उसको हम repair करके बाहर आ जाते हैं. So it's 1 to 1.5 hour job for us, and you can see how he walks now after over 1 year of treatment. This is from his home from Nairobi. So he's reasonably fine now, and what he has to say in Gujarati, I hope you can.
મને પેલા બહુ તકલીફ હતી, ઈંધણ આવતી, હલન થતું શરીર આખું. અત્યારે મને સારું થઈ ગયું છે, અને દવા મારી બહુ ઘટી ગઈ છે. અત્યારે હું 3 જ ગોળી પીઉં છું, અને પેલા હું લગભગ 20 ઉપર ગોળી પીતો.
So what he says is that he used to take 20 tablets and now he takes only 3 tablets, and he's still much better than before. And he can drive, he can go to his shop and be again integrated into mainstream life. So there is another type of treatment apart from just the radiofrequency ablation. It's called DBS. So I won't go into much details, but DBS is like a device for which the battery is implanted outside on the chest wall, and the electrodes are in the brain. They are hair thin, but they're implanted deep in the brain, and it does the same function. It has the same treatment for Parkinson's disease what RF ablation can do. But there are some differences. RF ablation is much cheaper and has no implant, while DBS has, of course, this implant to be made in the brain. So second is essential tremor. So kampan, Sadi Bhasha. So the difference between Parkinson and essential tremor is that there's only tremor in essential tremor. And पार्किंसन में कंपन के साथ साथ धीमापन भी होता है, स्टिफनेस भी होती है, कदम छोटे हैं हमने देखा, बट इन ट्रेमर इट इज ओनली ट्रेमर. सो लेट्स सी, दिस लेडी इज ट्राइंग टू मेक अ स्पाइरल एज आई हैव ड्रॉन, बट यू कैन सी इट्स नॉट सो स्मूथ बिकॉज her hand is shaking. On the right side, I'll show you the video of how she attempts to drink tea. So it's a slow-mo. So this is right after the procedure. The spiral is reasonably more slow. And on the right video, she again drinks water from the cup. So the improvement is real time, right, on the operation table. So I'll skip through these videos because I think for the lack of time we are already late. So another condition being dystonia. Dystonia मतलब हाथ पैर जकड़ जाना, बिना अपने कंट्रोल के हाथ पैर या कभी गर्दन, ट्रंक, पैर. So ये different organs, different parts of the body become twisted for no significant reason. So you can see the twisting of the upper body and the neck, and after the treatment the upper back and the neck become reasonably straight. So this boy had to be, he got unemployed because his employer thought that, something is wrong with him.
और मेरे गर्दन फिर धीरे धीरे दर्द होने लग गए और मतलब दर्द ऐसा था कि वो मैं स्टैंड भी नहीं कर सकता था. पहले मैं अजमेर गया था, वहाँ अजमेर डॉक्टरों से सलाह ली, वहाँ बोटॉक्स इंजेक्शन लगाते थे, वहाँ से कोई इम्प्रूवमेंट नहीं मिला. फिर मैं जयपुर गया, जोधपुर गया, एम्स में गया, वहाँ भी कोई इम्प्रूवमेंट नहीं मिला. फिर मैं दिल्ली एम्स में भी गया, वहाँ भी कोई इम्प्रूवमेंट नहीं मिला. हैदराबाद भी गया, लगभग 1.5 साल में यहाँ इधर उधर चलता रहा. और मतलब मेरी जिंदगी
again it's a long testimonial. I'll skip it for the lack of time. So this is another vertical now. Apart from Parkinson, tremor, dystonia, the fourth being severe pain. Severe pain, what I mean is the severe most pain, commonly in cancers, in injuries of spine and the nerve roots and the brain. So these people cannot even sleep properly in spite of best of the medicines, all painkillers combined, including morphine. So the quality of life goes very, very bad, and they cannot even concentrate on their daily tasks because ध्यान पूरा दिन उस pain पे ही होता है. So it impairs the quality of life in a very significant manner. So in such severe pains where there is no other answer, we can modulate the circuits of the brain such that कि जो pain perception है वो काफ़ी हद तक ठीक हो जाता है. So it doesn't completely get rid of the pain, but it reduces the pain to a significant extent.
My nerves was got very damaging, and some was cut off to the median roots, which make me so much painful, numbness, tingling, pain and needles, and sometimes I was feeling like someone pushed my muscle to the waist. I was decided to come here at Ahmedabad, STVP hospital. I met with a neurosurgery team, Dr. Sagar Betai, Purkit. They assist me very well. They do MRI and everything. I was described to them how I feel. So according to how they assist me, they was decided to do this surgery, or for RFA surgery. Thanks God, our surgery is going well. There is no anything like numbness, pain and noodles, someone pull my muscles, no. In 100%, the pain will disappear, 6%. I have insisted other people who have just kind of problem like me. There is no need to stay with neuropathic pain for which led to affected your daily activities. You should come here at GSP hospital. They are very good.
So it's a long testimony, I'll not run through the whole thing. So before I end, so epilepsy is another vertical of treatment. So routine epilepsy patients can be treated by medicines, even here, no doubt about it. So this is about 2 out of 10 patients who have extreme of epilepsy, recurrent seizures. So the parents are worried to send the child to school, to colleges, to go out of house for for all jobs and such. So it is such difficult to treat patients. Have to undergo surgery sometimes to remove the source of the sparks which are produced in epilepsy. So only for those advanced and complex, hard to treat patients, we have a department of epilepsy surgery where we offer these people the cure.
My name is Vijay Patel. I'm a resident of Mansa. This is my son, whose name is Sujal Patel. He is 21 years old. He had been suffering from epilepsy for the last 11 years. Despite taking many different medications, there was no improvement. Finally, we met this doctor. After meeting Dr. Zuben Shah, we decided to go ahead with epilepsy surgery. After the surgery, it has been 3 to 4 months, and he has not experienced any problems so far. Epilepsy surgery is safe. There have been no complications.
Right, and finally, stroke. So stroke is very important to diagnose on time because it is a very time-sensitive issue. Please don't bother to come to India or even think of that. If you, God forbid, if any of the known or near and dear ones have stroke, because the initial 4 hours are very, they are called the golden hours of stroke. So after the onset of any change in speech clarity, weakness or paralysis of one side, difficulty in walking, imbalance, or difficulty in understanding things, sudden onset, right? Any such sudden onset thing may be a stroke, and initial 4 hours are very vital, and you should connect to a hospital who has a neurologist in your vicinity, and so that the permanent damage can be prevented. So we have this facility, but I don't think it applies directly to people who live here, because the initial hours are super important, and one has to consult appropriate doctor who is a neurologist in a well-equipped hospital which has a stroke team. So again, I'll skip the testimony because of lack of time. And as already Sagar Gohani mentioned, some of the key achievements is that we are pioneers in such neuromodulation procedures, the epilepsy surgeries, and many of the stroke interventions as well. Thank you. I presume that we'll take the questions at the end after we have talked from all 3 of us.
You have them? Okay, sure. But thank you so much, Dr. Betai, for that fascinating presentation, for the realistic examples, and for all the advances, and for participating in all the advances in neurology. So before I invite the next speaker, I would like to ask, is there any burning questions that can be addressed right now? We can keep the seminar in a way that they present, and then we have a short question and answer section in case someone wants to get it addressed immediately. If not, just take a note of your questions, and after the 3 speakers we can have a combined question and answer session. Okay. So I was just also telling Dr. Sagar Pichai that the other day there was a senior faculty professor at our hospital that was asking whether we have neuromodulation. And I asked the neurologist in the hospital, and although there are efforts being made to bring it to the hospital, it's still not present, and it will definitely take time. So such examples are where if we know the hospital that does it, is where we can actually connect to people like Sagar and get connected to Dr. Sagar for treatment. So similarly, I would now like to welcome Dr. Bhupesh Patel. He's a pioneer in endoscopic spinal surgery with over 16 years of experience. He will discuss spine health and various disorders, as well as the management. So with another warm welcome, please, with a round of applause, Dr. Patel, welcome.
Good morning, everyone. Sat Sri Akal. We are definitely belongs to such a field that everybody just fear us. That they say, no, we don't want this thing. Yes, initially it used to be. If we talk about 10-15 years back, then yes, we are very. Our field was very primitive. And that time we don't have that good kind of imaging modality, so that chances of complications were very high. But now with advent of magnetic resonance, MRI imaging, and endoscopic and minimal invasive surgery, so all the kind of complication we have reduced significantly. We can say almost none to all. So I am talking about endoscopic surgery. So now we are in the safe end. So it is a least invasive. So what we compare it like surgical strike. So we just decide our target and we just eliminate the target. We don't do any collateral damage. So this is our prime motto of doing endoscopic spine surgery. Don't damage any muscle, any bony tissues and nervous tissue. Just be always safe. Again, we do very small hole around 6 to 8 millimeter incision, and no bone cut and no muscle cut. So I compare it like tooth extraction. When we went to the dentist and he just gave us some local anesthesia and remove the tooth and discharge it within 1 and 2 hours. So same we can discharge in the evening patient after 4 to 5 years. Again, no muscle cut. So whenever you have back surgery and you have very big incision and muscle cut and bony cut, so you after surgery you have some kind of back pain and stiffness. But when you don't cut these muscles and tissue, you don't get that kind of pain. Again, we don't damage the bone. We just resect the bone which is necessary. So chances of instability are rare. So in my practice, if I operate 100 patients, I don't put too much screws in that patient, because when you put the screw, it make that part stiff and increase the stress at upper level. So we just only decompress. We just decompress the tissue which is causing impingement or compression on the nerve. Again, these are the magnification. We say it around 22x magnification minimal. So our small hair it becomes 22x large. So chances of nerve injuries are very rare. Again, we don't put a very big incision, so bleeding is very less, and we constantly use the saline, water flow. So chances of epidural bleeding is very less. If the bleeding is less, then fibrosis also reduce. In majority of patients, we use the sensory epidural analgesia or local anesthesia. So during the surgery, patient can move their limb, and so that we can just during surgery we can see how much traction and how much stretching we give on the nerve. So chances of nerve injury is almost minimum. And because of sensory epidural anesthesia and local anesthesia in old age patient, that are not fit for the general anesthesia, and chances of complication is high because of cardiac and other issues, respiratory issue. With that patient, this surgery is very safe. And these are the one approach we are saying. So these are the one of the kind of surgeries we call it transfemoral endoscopic surgery, where we go around 10 to 14 centimeter from the midline, and we put our instrument around 6 to 9 millimeter instrument, cannula and dilator. Without muscle cut, we perform the surgery and we can discharge the same patient. So this is one of the example. This is the huge herniation, the disc, and in MRI you see very severe right leg pain, and this is how we plan under magnetic resonance imaging, and we call it PACS. And this is our instrument. So it's a very small tube cannula we put to the C-arm guided, and we perform the surgery. This is one of the example how we do surgery. I'm just keeping it little fast so that we don't waste too much time. And this is how we remove the herniated part, and we completely decompress the thecal sac. So this is the last picture. So in the post-operative you see the herniated part removed, and we do all the patient MRIs to see the adequacy of decompression. And this is the scar. Even after 15 days you don't realize that where have you been any surgery, and even after 3 months of the surgery, if you do MRI, even MRI people cannot tell that you have underwent the surgery. They said yes, initially there was some stenosis and herniation, but now there is no stenosis, no herniation, but we cannot find any surgical imprint. And so we have that kind of impression, the spine surgery always fail. No, with the advent of technology, especially endoscopic technique, the chances of getting all right is very high, next to almost 99%. And this is the same. Even after surgery, you just have to take a rest and you cannot do any work. But this is the example of this patient. He is farmer. I did surgery around 2 months or 1.5 months back, and he sent me this video that I am lifting 20 kg, 30 kg weight, and I am doing all my farming work. So even after you can walk a marathon and do all the routine activity, mountain climbing, all these things. These are the one more patient, around 85-year-old male, which is having severe stenosis with the cyst, or we can call tumor in the spinal canal. And when he arrived, we found on imaging that he has myocardial infarction or heart attack. But even though we keep that patient in ICU for 4 days, and after that we performed the surgery under local anesthesia. So he was the brother of one of the very famous surgeon in our town, and we did endoscopic surgery on him. It is on table, immediately table, he started moving the leg, and we can discharge him on the very next day. So spine surgery cannot be done after 8 years. No, it's never too late. If you are doing stretching too much, then you can present with the weakness. If you do a surgery on the very late, then chances of recovery is also less, because once your nerve got damaged, even then we decompress it, will not get good results. So with the advent of this kind of technology, you can do. This is the patient we did a live surgery in front of so many surgeons. So even severe stenosis or very weakness patient and disc herniation, we can do endoscopic surgery. You see our incision, and this is very small. You don't even realize that you have been underwent any surgeries. So these are the decompression we are performing with endoscope. And immediately post-op, the patient is, because of sensory anesthesia, he can start moving the leg and recover all the time. So if this patient doesn't move any limb before that, totally paraplegia, but immediately after surgery, he started moving his leg, and in one time he completely recovered. So these are our scar, the surgeries. And with the spine endoscope, this is a newer one, we can even do the fusion surgery also. He was 40 years old gentleman with having spondylolysis and listhesis. Their vertebrae is moving on each other. So even that, we can, with the help of endoscope, we can remove the herniated part, we can prepare the end plate of the vertebrae, and we can put the cage very safely. So this is a cage how we put through endoscope. So this is the other modality of endoscopy, different technique. So we just decide on the MRI just which technique we want to use, and we use which is least invasive and which is most beneficial to the patient. Okay, so immediately after surgery, he started after 1 hour, we mobilize them and we discharge them. The very next day, when we put the screws in the patient back. And these are not the same. So this is our scar of putting a screw, and these are the screw with open surgery. So we don't do big cuts, so we don't cut muscle and bone, and we just do. Even 88-year-old lady with very severe 4-level disease, stenosis and compression, we safely do this the surgery in this lady. So you can see all 4-level decompression, and after 1 hour after surgery, we asked her to mobilize. She was bedridden, she came with a wheelchair, and immediately after surgery, she started walking. Even already open surgery previously done and it was failed, we can do an endoscopic surgery very well, because here our water flow can dissect the tissue plane very well and we can do adequate decompression. So these are our final picture. Even with these are nerves, so we have very well decompressed nerve, even with the revision case also. Even in the neck pain or cervical spine, where patient is having myelopathy, not able to make the balance, and like he just have drunken and is walking like this and is having numbness and frequent fall, this kind of patient, we can easily do endoscopic surgery. And this is the same research, because here we don't give big cut on the front of the neck. Here we go between the vessels, carotid vessels, we call it, supplies the brain and trachea and esophagus. So once you go from back and do endoscopic, this all the vital structure you can escape and you can preserve very well. So this is always in thoracic spine, is a little more risky area because chances of complication are high. But with endoscopy, we can minimize that complication. This is our scar in the cervical spine. So in multi-level stenosis in cervical spine, we can do endoscopic very safely, and so most of the we have concern that after surgery I'll get paralyzed. No, now that days are gone. Nowadays we can safely perform the surgery, and if needed we use the neuro monitoring, so that we can monitor your activity during the surgery, so that we are not doing any damage to the nervous tissue. And yes, many people ask that, can you give a guarantee for all right after surgeries? So I say, today we live or tomorrow we may die, we don't know. So guarantee we cannot give, but certainty we can give. Yeah, 99% you will be all right after surgeries. And this is very common. My one of the relative doesn't get benefit after surgeries. So we say two twin people twin siblings are not the same. So we have to see what kind of pathology he have, what kind of a problem he have, how long problem he is suffering from, and how much weakness before surgeries, and how much of it pathology. So there are many criteria. So each and every patients are different. So don't compare with your neighbor or relative that he got some complication and that's why we are not going, and he got all right and why I am not getting that kind of benefit. So this is like example. This patient is having cervical spine injury and this vertebrae got dislocated and it's got completely transected. So in this patient, even if you do a surgery, he will not get better. We are doing surgery just to make him mobilize. That's we can sitting on the chair, because his cord is completely shivered. And this patient is only compression, although he is present with the same weakness, but this patient will definitely recover. But this patient will not recover in his lifetime. So it is a before surgery, how the trauma patient is having, how much symptom they are having. So again, I am saying the timing of surgical intervention is very important. So many people just lingering on because of fear, and they came, eventually they'll end up with the surgery, but they came very late. And that time you already now got damage. So once that damage, that we cannot have anything to recover. It's only God wills if that recovered. So spine surgery doesn't, now after 1 hour of the surgery we mobilize the patient. So it doesn't mean complete bed rest. Nowadays because of our family structure, initially we have a joint family, so someone will take care of some family business if someone is lying in the bed. But now nuclear family, we cannot allow to take rest on the longer period of time. Again, spine surgery doesn't mean the patient will have neurological worsening. There are chances some patient may have some edema, but eventually most of the patient will recover. And most spine surgery doesn't mean that it won't be successful. Almost all the surgery got successful, but again, preoperative revolution is very important, and it can be done at any age, because we are not giving generalizations to every patient. So surgery is just safe, effective, and if you give have excellent outcome if we choose very right patient for an indicated case, and reliable. And why with us? Because we are the best in the town. So it's usually the team approach. We have a very good team of anesthesia, very good colleague, our surgical colleague also, and we do all pre-operative evaluation preparation, and we counsel and explain everything, and we do very small minimal footprint after the surgery, and we use all the modern technology like navigated spine surgery, and again we do very good rehab after the surgery. So all the intervention we require, we can take it out. And it is all the team approach and patient-centric approach, and again outcome is individualized approach. All we do pre-operative evaluation, and rehabilitation is very important, so we do on-call video call consultation for further rehabilitation if any patient came here. And so why again in conclude, so I say when I was in medical college 2001, that time open cholecystectomy was very much prevalent. Majority of surgeons do open and they do a gallbladder surgery. But at that time, the endoscopic, laparoscopic surgery are newer. So surgeons are learning at that time, and they take at least 3-4 years. But if you go compare in 2023 or 26, in the Lowell Bailey, we call it our Bible of surgical textbook. They say laparoscopic cholecystectomy nowadays is a gold standard. So endoscopic surgery in abdomen is gold standard. Similarly, in the spine, we say endoscopic spine surgery is a gold standard. In next 3 to 5 years, it will become, everybody has to do that surgery. Otherwise, you will not get desired benefit. Yes, the learning curve is difficult and long, but once you acquire that enough skill, then everything is easy. Okay? So we are regularly conducting the training courses for the surgeon also, neurosurgeon and orthopedic spine surgeon who are very much interested. Recently we concluded the course, and if anyone is interested in your Kenya, they can come and train with us. So I'll say the endoscopic surgery is the only destination, we don't have any alternative. And this lady, of our nursing staff mother, I operated 3 months back, and we are doing just our folk dance, Navratri just before, and just so, thank you.
Thank you, Dr. Patel, for that once again fascinating presentation. I'm not sure about the rest, but I'm also getting very excited by such approaches. I never knew you could do spinal surgeries with endoscopic assistance. So I hope everyone is also learning as much as I am. And as you've heard, there are various spinal disorders. They affect millions. Some arise from trauma, some arise from various occupational hazards we have. Some come with degeneration, but as you've seen, they can be managed. But again, we need to be very conscious about the timing and appropriate, referral navigations. So, lastly, I would like to introduce the last speaker from the SGBP hospital. His name is Dr. Kamlesh Devmurari. He's a pediatric orthopedic and deformity correction surgery with over 20 years of experience. He will share insights into various children, bone deformities, and modern orthopedic care for such conditions. So please welcome Dr. Kamlesh Devmurari.
Very much for a kind introduction, and Sasrikal, Namaskar. Far away from India, and I'm feeling so homely here. So thank you very much for giving such a warm welcome. Because of this two talk of adults, so now I'm feeling like so young with reference to you guys. So a few cases that will be really useful your grandchildren or some of the children for you. So why this talk? So many children deformities are treatable if it is timely treated, or we can catch up in time. And why parents are needed? Because they are the first doctor, like parents or grandparents, dada dadi or nana nani. They are the first doctor to identify the abnormality in children, because they spend more time with kids. It's very important. In our India, most of the time in my OPD cases, they have complained like that. It's like, सब कुछ सही लेकिन दादा को या दादी को ऐसा लग रहा है कि पैर टेढ़ा चल रहा है. So this is the first doctor you will identify the deformity. In your mind, because why this branch is developed? We believe that children are small adult. It is not like that, because children are growing. The bones are different. The bones having a growth plate. The structure of children's bones are different. So when the structure is different, the management is different, presentation is different. So if timely treated, we can prevent the future deformity, the future problem. So let's see some deformity or some cases that will use. This child, you see this parents came with the deformity. So what parents notice? The legs looks curved. You see the leg, knees touching, but ankle apart. And there is difficulty in walking. If you see the walking pattern of that child, so how child walks? And the complaint is parents. One is cosmetic, legs doesn't look normal. That's the first thing. Second, child having a complaint of knee pain. And third is that there is difficulty in ground clearance. So when the leg is not aligned, and there will be difficulty in walking. So how can we see, before the COVID era, all over the world, before the COVID era, this deformity was not that much significant. I am operating this case every month, 3 to 4 cases in a month. But after COVID era, the incidence of the deformity is dramatically increased. A couple of reasons. In India, the most commonest reason is in the COVID era, we are in the home, we are just locked in the home. So we don't expose the sunlight, UV lights. So the vitamin D deficiency and calcium deficiency, that is very, very common, and that leads to deformity. Second thing is, because of these gadgets like mobile, iPad, and the most of are not having an outdoor, the indoor activity is dramatically increased. So there is no outdoor activities, the deformity burden is also increased. And third thing is, the food quality has been changed. In India also, the quality of food is changed, and the deformity is day by day. So recently, we operate almost double cases every month. So before 90s, the surgery was performed for that cases, but nowadays there are such evolutions going on. What has been done before that 90s? We have to wait till child get mature, at bone get mature, then we do a osteotomy, we cut the bone, we put a bead plate there, you have to immobilize for 6 months. It's a major surgery to make straight the bone. But nowadays the concept is completely changed. That is called, just like Dr. Sagar has mentioned, neuromodulation. The same concept came, the growth plate modulation. You just modulate the growth plate. During growth, the child becomes straight. It's very innovative. Just 1 centimeter incision, no immobilization. Next day, children go to the school, and just you have to observe how child goes. When height will increase, automatically the limb becomes straight. That's very good innovation for that. See, if you see this result of that was before surgery, and this is after surgery, within 7 to 8 months, with a 1 centimeter incision, no restriction on the activities, and deformity is corrected. So there is a big innovation for the medical science. So But the importance is you have to identify in time and manage in time. So time is very important to the growth module surgery. Let's see another case. Nowadays, because the deformity incidence is increased overall, this is a congenital anomaly, birth defect. So many cases we got like that. So baby is in the womb, but the foot is like that. That is called clubfoot. So parents and all the family is in the worry. So my child become normal. There are a couple of questions. What is the future of the child? And will the child born with this deformity? So now the question, is it curable? And what is the future of the child? If we miss the train, if we don't identify in time and not treated in time, and this is the future. And you can see how can child live with such a bad fit. It is very difficult to live. If you stand with a bent foot, how many minutes we can stand on that foot? It's very difficult to live. So that's a big burden if we'll miss the train. But if it is timely treated, these are the all celebrities, they have a club foot, but they are treated, they all are Olympic gold medalists, and that's a normal life. So why I am discussing this deformity? Because this is the most commonest congenital deformity. Every 3 minutes, the baby born with the club foot. And if it is timely treated, there will be no deformity. It's almost 96% results are there. But the game is the time. If it is untreated, it is a big burden to the society, to himself or herself, and to the family, to the nation and all over the world. It's a big burden. But what is new thing? Before 90s, surgery was performed for the club foot, but require admission, there are bigger incision, bigger surgeries, lot of complications, and lot of relapse and recurrence for the club foot. Before 90s, treatment was there, but afterward, the two men came into the picture, like Ignacio Ponseti and another Sahib Pangani. So both they came and they changed the concept of club foot, they changed the management of the club foot, and they changed the principle of the management. And it's a big evolutionary. And good part is, the Sahib Pangani is from India and he traveled all over the world, and the complete principle of management is changed. You can see the difference. What do you find that? Start treatment as early as possible. That is called Ponseti technique. In this technique, there is no incision, no general anesthesia, no admission, just OPD procedure. And within 2 months, baby become absolutely normal. This is a big evolution in medical science. So you can see that the baby born with a club foot and treated within 2 months, child become absolutely normal. Okay, so we do so many club foot cases, neglected, non-neglected, but the importance is time. If we treat in time, definitely we can help so many children with the deformity. It's a big social work for the society, for the nation, for the world. Another aspect now, this is about the congenital anomalies. Children fractures. Recently, 10-year boy from Sicily, East Africa, they traveled to India and taking primary treatment. So you can see that it's a compound bad injury, and unfortunately they suggested amputation. So we can't survive the foot. Shifted to India, and why I put this case? Because children's bones are different. Children's are not. We have to preserve the growth plate. So what we did, we tried to preserve the limb. We tried to the soft tissue management, bony management, and growth plate preservation surgeries. And see, these are the how it was managed. And fortunate part, after 4 months, he stayed at 4 months. And all fractures are united, skin wound is healed, and Tejas is ready to fly for Cecil again. So the principle is, if timely treated, that will give good results. Children bones are different. We have to take care of the growth plate. So before I think 7 to 6 years, this deformity, this is very common in African countries. Name is Thomas Ogutu. Before I think 7 years, we travel India and they want to make it straight. How to make it straight? So why I put this case? Because technology is so advancing. So it's a very complex deformity. We require multiple surgeries with technology. So what we did the surgery on the patients, then the technology will take care. The AI is taking care. So software has decided which rods. So I put some fixators, rings. Which rods we have to move, that will decide by software. Everything taken care by software. And you can see the results after 60 days of restriction. And these are the before surgery and the after surgery. I did a couple of surgeries in the Rodney, and now Rodney is a famous chef in US. He shifted to US, living a normal life. So the things are, see the evolution. It's not only we have to accept the technology, we have to accept the AI. We have to evolve. So with technology, you can give best results. Very commonest, if you having right now, if you will check our foot, the flat foot, it's very common. If you go back to your home and check your grandchildren, they're having a flat foot. So foot alignment, it's very critical for standing, walking and running. So why I am discussing this case? Because in my era or in your time zone, we are so adaptive. Our acceptability is so high. So we have accepted the flat foot deformities, but now the kids, they will not accept the flat foot because the bones are different. They are in a different time zone. They have a different the bony structures. They have more flexibility. So the adaptability after 50 years of that flat foot, that will be difficult. So why I am telling this? So what are the flat foot? See, this is the difference. My right is the flat foot, left is also flat foot. But which flat foot may cause the problem? If you see this flat foot, this is normal flat foot, but the other one, there is a rigid flat foot, that can give a big problem in future. So we have to align that foot. So foot is aligned, body is aligned. Like, so if we run a car, but if your wheel is not aligned or balanced, car will run, but the wear and tear is very common in the tire. Same way in the body, initially it is okay, the flat foot is not aligned, but if it is malaligned, that leads malalignment to the body. It gives malalignment to the ankle, knee, hip and spine too. So, what are the treatment options for the flat feet? We'll give some physiotherapy, but it will not work. You can give some orthosis and some shoe modification, but the literature evidence says it will not work. It will not stabilize the ankle. It just gives a false sense of correction. We do some surgeries before 20 years, do a couple of surgeries, but results are not good, that much good. So the new thing came that is called stent. So as we know that in our heart, whenever there is a problem, we put a stent inside. The same we do a stenting of the foot, that we can prevent the complication of flat feet. So stent is minimal invasive, it's an internal option, it is permanent, it is reversible. If it is not okay, then you can remove it. Used both in children and adults too, and it is time tested and evidence based. What it is? It's a small titanium stent. There is a space in the foot. When the foot is subluxed, significantly operated, put a stent there, stabilize the foot, and once the foot is aligned, there will be no major complication in the future. So very simple technique by using, see on my left upper, there is the flat feet, malaligned feet. It's a 1 centimeter insert, put a stent inside, and you can see the result after stenting, foot get nicely aligned. So if we are treating the future of our the deform, we can prevent the deformity in the future. So I have to conclude, because this is to conclude my talk. So children are not small adults, that's the first thing. Second thing is, we have to take care. If we will take care right now, then we can prevent the future complications, and definitely the deformity is treatable. If it is treated in the time, we can reduce the burden of the family, society and nation all over the world. So thank you very much for a kind hearing. Yeah.
Before I open the floor to question and answers, and before I introduce the next segment, I would like to thank all the speakers. Thank you, Dr. Kamlesh, for that brilliant presentation also. I was fascinated by the mention that in our culturally sensitive settings where parents and grandparents are the main caregivers to children, they should also be able to recognize these disorders instead of them lingering on and affecting the precious futures of our children. So thank you for sharing examples and thank you for the brilliant work and care for the children globally. So, similarly to how we've had images and videos and examples given by the specialists, we also have testimony that we wanted to give. There's a parent called Nelly Amir, who is the parent to a patient called Monal Rizwan with multiple sclerosis. Which is an autoimmune condition that affects mainly nerves. Our nerves are like wires. They have this insulation sheet. And sometimes our immune system recognizes this wrongly and starts attacking the sheets of these wires. So patients get different functional issues from those attacks. So welcome Nelly Amir.
I found out about Dr. Sagar coming to Nairobi and I was over the moon. This is my personal testament for Dr. Sagar and the SGVP hospital. My 13-year-old daughter was diagnosed with multiple sclerosis, which was a journey and a half. She was experiencing imbalance and she would fall without any known cause. And the doctors in Mombasa, I have traveled from Mombasa to come see them. The doctors in Mombasa could not pinpoint to what was wrong. They would say heat stroke or dehydration. And as a parent, we do not usually think of the negative things. But then we went to extensive care and extensive tests, and she was diagnosed with multiple sclerosis, and nobody would take her case. Not one doctor. They told me we have no experience with it. And then SGVP was recommended to me, and I went there and my life has changed. For 14 days, my child was in that hospital. The staff, the medical care, Dr. Sagar Batai, to me he's my personal God. My daughter walked, she could not walk actually. We had to support her when we went to the hospital. Through the airport, everything. For 14 days, Dr. Sagar Batai treated her and he made her well. my daughter walked out of there by herself. Every single day she grows stronger. The hospital staff, everything was brilliant. To me, there is no second option. He and his staff and his team were brilliant, just brilliant. My 14-year-old daughter, she turned 14 in the care of Dr. Sagar. Today walks on her own. She has strengthened, she can walk, she can run now. Whereas the doctors here told me, we cannot take your child's case. So if you ever have a chance to go to India or to Ahmedabad especially, I would personally recommend SGVP Hospital. Their customer care, the way they treat you, you do not feel like an outsider. And with regards to medicine, I thank you very much, Dr. Sagar. My child, she's my only child. This is my personal testament. He is brilliant, brilliant. He looked after her, he helped her walk, he guided me. Even today, he has visited her and seen her, and it has given me peace of mind as a parent. I just want all of you to know that I have full faith in all of these doctors, and you should too, in case of anything. Also, one of the doctors mentioned time. Time is really of the essence. With my daughter's diagnosis, I took a while because the methods of treatment start mild and then they progress. So my daughter was given the last resort because the initial treatment did not work, steroids, but Dr. Sagar assured me that he will make her better. And today he assures me again that she will probably never have to go through what she went through for the last 3 months. So I am very grateful, and I'm very grateful for this opportunity to let you people know that these are very good doctors and I trust them. Thank you so much, Ramgarhia, for bringing me here, and I am grateful for this as well. I just want you to know they are the people. They are the people. Thank you very much.
So thank you for sharing that testimony. Also very touching, and thank you for the great work, you guys. You can see that you're truly making a difference. Kilometers, thousands of kilometers away from your home country. So now the floor is open. I would like to encourage anyone to ask any question. No question is small when it comes to health. Please also feel free to openly share any issue you might be having. We can figure out how to help you and address the question, at least for now, and assist you after the session. So, yes.
Hi. I have a question for all three doctors. I wrote them down when I was listening. So, hi, my name is Kamal Kaur, and that was very informative. You spoke in layman's terms. There was nothing that was not understood. You spoke clearly, and all three of you did a really good job at speaking to all of us today. I derived some questions from what you talked about. I'm also a reporter at the Asian Weekly. I'm an editor there. So I thought it would be nice to incorporate what I ask from my personal point of view to add to what I write about. So this is for Dr. Sagar Batai. Are there specific triggers or daily lifestyle factors that could be bringing on these motor symptoms?
Yes, ma'am, I couldn't understand the question properly. If you can please repeat.
Okay, so you talked about there were triggers for Parkinson's and stuff like that. So I wanted to know what something in our daily lifestyle, what could be triggering these kind of things, so that those who are not yet there or may never get there, but we're more in control of how we approach Parkinson's.
So I think preventive measures for all the neurological disorders. So more or less they're quite common prevention factors and common trigger factors, so to say. for many of these conditions like dementia, which is memory impairment, like Parkinson's, like tremors, a stroke, and such. So I think, and you rightly said that lifestyle is a significant modifiable factor which we can improve upon. It, I think, rests on 5 pillars. First of them being our food, and when I say food, I think things are still much better in Kenya compared to India. The pesticides have not yet reached to that level as they are in India right now. So I think the closer the food is to the nature, better it is. जो मेरी दादी मुझे खिलाती थी, that food I think. So there's no rocket science. So more processed the food is, the more packets you have to open to eat your food, the worse it is. And the closer to nature, so farm to my plate and farm to my kitchen and to my plate is much better than coming through the factory. So in simple words. And they give a long list of which you already I think know. So that food is one part. Second is sleep. Sleep is, for me, if you ask me, the number one factor is sleep. So timely 7 to 8 hours of sleep. Again, this is very simple but not so easy always to implement. So because good sleep regenerates and makes up for the wear and tear of your brain and the body at night, and consolidates the memory. So for example, whatever I talked today, if your sleep is not so good, tomorrow and day after and for a year or 2 years, you may not remember all that we have discussed today. If the sleep tonight is not so good, so whatever we learned, all the input in the brain is consolidated on the same night and the next night in sleep, so that you retain for long term. So the corollary of that may be that if a person doesn't sleep so well, shallow sleep, frequent interruptions, late night sleeps, irregular timings, then they may not have good memory going ahead. So that's the second part. Third being exercise, because the physical and the mental health are completely in sync with each other. आज मुझे बुखार है, मैं बीमार हूँ, तो mentally मुझे depressed feel होगा. I will not be curious about anything else, right? The same way, if I am feeling sad or negative, my body feels weak. So it works both ways. So a strong physique, a strong healthy body, when I say strong, it doesn't need to be muscular lifting 50 kg of weight. What I mean is you must be able to walk around without breathlessness, without back pain, go around places, climb stairs, sit up and get up. So daily mobility, so keep moving is a very important message. It's just 2 words actually, you know. So sleep well and keep moving are very, very fundamental and very important messages which I can ever deliver actually, and which works across all these diseases for prevention, right? Number 4 being social interaction. So the community gathering, this itself is a testimonial to what should be done, you know. So you meet people, you exchange positive vibes, you talk about different subjects, it engages your brain, it forces you to think for different subjects, right? If you confine yourself to very few people and to your house only, then it's a very limited fund of knowledge. You don't test your brain every single day. So it's very important to keep communicating to especially people who have a pleasant, give you a pleasant vibe, you know, positive people. So that's super important. And I think avoiding any stress factor like tobacco, excess of alcohol, and even screens. You know, these days screens have cropped up in ranging from a newborn child to an old person. So avoiding the screens is very important for physical and mental reasons, because attention span has shrunken superbly. Very sad point. And second, the critical thinking, that whether I should be even doing this or not is not what you think. You only think of कि Iran सही है कि America सही है, because it tells you what to think about. It doesn't tell you what exactly should you think, but what you should think about. Rather than think about your well-being, you think about what you see in the screen, right? And once you touch something negative, something remarkable, some bad news, and it knows that you are curious about such bad news, and your world becomes limited to that negativity around it. So it's very important to immune your your brain from these devices. So these are simple things, but not always easy to implement.
Thank you. Thank you so much. Can I go ahead and ask the other doctors the questions? Okay, I've got a question for Dr. Patel. Even with the minimal invasive surgery, what does post-operative pain management and reliance on heavy pain medication entail? It may be minimal, but obviously there will be pain, isn't it? Because
yes. When we do endoscopic decompression only, we don't need any pain medication post-operative period. Sometimes patient may have some kind of tingling tingling and numbness in the leg. We may add some kind of neuroleptic like gabapentin drug something. Otherwise, majority of cases we don't need any pain medication. Yes, if we stabilize, we put some stabilization add, then patient may need to for 2 to 3 days. After that, we don't even prescribe any pain medication. And if the patient's pain tolerance is sometimes too low, then yes, we give for at least 1 week and 10 days. Otherwise, for longer, after 10 days, we don't prescribe any pain medication for any patient. So, and yes, patients having some kind of nerve injury before the surgery, that patient needs some kind of treatment for at least 1.5 months. But otherwise, normal patient with radicular pain, compression, we decompress it, they don't need any medication. But yes, sometimes we, as an orthopedic surgeon and a spine faculty, we usually prescribe to strengthen their muscles and bone. So we usually give a vitamin B12 and vitamin D3 preparation and calcium preparation for at least 3 to 4 months so that their spine and their nose and muscles become strengthened.
so the pain is basically a chemical imbalance, so which can be sorted out by taking particular vitamins that are lacking in the body or something?
No, pain and vitamins are different. Vitamins is just to strengthen your nervous tissue. Sometimes because you have weakness and because of chronic compression, there is a changes happens in the nerve. So just to regenerate and just to rejuvenate the nerves, we need some kind of B12 because B12 is a very important component to form the myelin sheath around the nervous tissue, if I'm right. Yes, so for B12 you need a supplementation because the compression, whatever there is compression, some kind of damage happens in the nerve. So just to recover that damage, we need some kind of supplementation.
Okay, so this obviously means that you are talking about B12. It's not our cue to go out and buy a supplement without knowing that we need it, right? A lot of people do a lot of self-treatment with
So what I'm saying, when you age, so you become older, then definitely your nerve tissue get degenerated along with your aging. So and especially when we are a vegetarian community, because especially in our part of country, so we don't get too much of B12 sources. Because vegetarian only milk, apart from milk, no other have B12 sources. So that patient or that kind of community definitely needs some kind of B12 supplementation just to keep their nerves healthy. Otherwise, all these cognitive functions and all the neurological degeneration, the things happens.
Thank you so much. Thank you. For my third question. So we were talking about children's bones. So because the child's bones are constantly changing, how do you fix a congenital deformity without accidentally disrupting their natural growth patterns? I'm going to talk of a personal experience here. In 2013, my children and I were in a terrorist attack, and unfortunately my children still have shrapnel in their legs. Now they were 12 and 8 at that time, and as they grew, I found that my daughter had a lot more shrapnel in her legs. It would tear into her. We were advised that surgery cannot take it out because there were lots of thousands of small pieces that were embedded, and some still are to date. But she used to complain a lot of pain in her legs, and I was so frustrated as a mother that nobody could help me find a way. She couldn't even do an MRI because obviously of all the metal in her legs. So for me, that has been a personal journey, the question I'm asking you. So how do you deal with it without disrupting their natural growth pattern, because they're still growing? And my daughter was told, oh, these are just growing pains. No, they were not growing pains. But I'd like to know more about this, please.
So whenever there is like fracture, the principle is we have to take care of the growth plate. So whenever there is a trauma, I think this is the best time to treat. So once it has been malaligned or once it has been deformed, then there will be difficulty. We have to take care or we have to correct the deformity. But the main crux is, so whenever there is a trauma, you have to align the growth plate anatomical position. That is the first principle. Okay? And the second is, if the physis is multiple layers, so we have to preserve the germinal layer. So how can we preserve the germinal layer? So if we preserve the germinal layer, and then we can prevent the further deformities. So that is the first principle. Second is, you are telling that now everything is fine, but still there is a pain. But child is growing. Okay, so child is growing sometime during growth, child having a growing pain. So the most commonest reason of the growing pain is the whole minerals, vitamin deficiency. This is the most commonest cause of growing pain. 90% cause of the growing pain, night cry or night pain or night growing pain, that is vitamin D, B or mineral deficiency. So if you suffice this deficiency and will add the deficiency, most of the time the growing pain will go. And if it is not grow, still will not get the result, just wait for time. Within, after once she finished 15 or 16 years, the growing pain will go.
She's 25 now, so
that's so that's you have to check for that deficiencies. The most commonest cause is the deficiency.
Thank you so much. Thank you.
Thank you for your questions. Anyone else? Okay, we can start.
Thank you very much. I would like to ask that if your nerves are damaged during the spinal cord surgery, is it possible to get them regenerated?
Yes. There is two kind of nerve damage. One is nerve damage because of chronic compression. So if the patient is having chronic compression of neural tissue, if you decompress, yes, there is regeneration happens. But if the nerve damage happens because of trauma, suppose a patient is fall from height, or they are having a road traffic accident, the spinal cord damage because of sudden injury. If the cord is completely shivered, it is transected, then that can never recover. But if cord is compressed and there is still a little bit of sensation in the leg or little bit of movement, the chances of recovery is very high, because now again started regenerating, and that can give you a good amount of recovery. But in a chronic compression, if you do a timely intervention, then chances of recovery are very good. But most of the patient is because of just fear, they don't come early, they usually come late once there is irreversible damage happens in the nerve, and they don't get that recovery what they expected. So timely intervention is very important, yes, but traumatic paraplegia we cannot give a guarantee. It depends how much power you have before, at the time of trauma, and how massive impact is there. So amount of injury depends on the, make the outcome, how good outcome you have. So traumatic spine recovery chances, once it damaged, chances is very rare, but yes, compression, chronic compression, long-standing compression, chances of recovery is very good. We should try.
Thank you. Thank you very much.
There was also a question in the front. Go ahead.
Right, I'd like to ask, a drop foot, it is basically a neurological disorder. Apart from handful of supplements and physiotherapy, is there any other treatment for that? A drop foot.
Sorry, which disorder?
A drop foot.
Foot drop. Yes, again, foot drop, why it happens? We have to go to the diagnosis. If there is nerve compression in the lumbar spine or in the cervical or thoracic spine, why it happens? If the compression happens in the spinal cord or spinal nerves anywhere, we have to decompress. So chances of recoveries are good if you decompress on the time, but it becomes very chronic, like suppose we say almost 1 year or 2 years since they have foot drop. So chances of recovery is very less, and then we have to give some kind of orthosis support and foot drop split and all this thing. And many times, if the single nerve is damaged, then we can have a surgical transfer of tendon. We can transfer the tendon from the back of the leg to front and we can use some kind of movement. But yes, but the toe movement, if that doesn't there, that will not recover. So again, saying the intervention on time is very, very important. So if you get a foot drop of 1 month or 1.5 months, now if you do surgery, then chances of recovery is very, very good. You go do good physiotherapy, stimulation, call it electromagnetic stimulation, like Kelvin stimulation, that can help to recover very well. And if it happens because of some kind of neurological disorder like atherosclerosis and all these things, that usually don't recover with time. And neurological, I think Dr. Beta is best person to say.
Thank you very much. Sorry, I would like to just comment something. It's great having you here, and everything has been covered more or less apart from cardiac. So we are missing on that information and knowledge. And secondly, you see, it would be good if you elaborated more on dementia. As age is progressing with every other aged person after the age of middle age onwards, they all complain about dementia, forgetfulness and stuff like that. And if you can sort of say more about that. I know you did mention to come out that it is the good food, exercise and good sleep. But apart from that, anything else, preventive especially.
Right, thank you ma'am for your feedback. And regarding the first question, our cardiologist could not travel with us for different type of reasons, but hopefully sequentially, annually we may make it to Kenya, and he may accompany us the next time. Regarding the second part, apart from what I already told ma'am about the prevention, which all is completely in line with dementia prevention as well, cognitive exercises is something which is special for preventing dementia. When I say cognitive exercises, it's just like the gym is for the muscles, these cognitive exercises are for the brain. So new learnings of any sort, be it music, be it some new folk song, some poetry, talking to new people, learning what they do, how they do, any new learning starts new networks in the brain. And when I say that a person gets confined to the house, then they stop new learning because they don't meet different people, they have the same environment every single day, they are comfortable, but they are degenerating slowly, right? So new learning stimulates your brain and forces the brain to make new connections, dig deep into your fund of knowledge. That when I say tibia, so you say what is tibia? So you may Google and see, tibia is a type of bone which is in the leg. So such new connections, new learnings are to be forced. Mathematical things, like for example, household chores. So keeping a tab on the daily grocery. So what was the inventory? How many items have come? What was the price? What's your monthly expense? How much do you save? Not save? It's not for the sake of saving. It's for the sake of your mental math. And try not to do it on paper. So try to do it in your head as much as you can. Sudoku, crossword. These are all examples of stimulating your brain in different ways. So all these things help a lot to prevent your brain from degenerating with time.
Thank you.
One more thing. Calculation, the financial part is very important, how to file a return and all these things, when you, especially for the male patients, if you do all this kind of calculation, your pain, every time you just find a newer aspect.
Right, just finally, just last question. Dementia was not so evident, or not evident, or not happening so much earlier. It's happening more, becoming more common.
I think
Isn't
so.
it?
I think so, yes. It is unfortunately.
Is there a reason to that?
So there are two aspects to this. One aspect being that we are living longer than before. So the lifespan in India, for example, has increased from 37 years of mean lifespan during our independence in 1947 to now approaching 73 74 years. So within that period, imagine how big it has increased, right? So with age, its surface is more than otherwise. And even if you match the people for age, for the same age period, it's still more prevalent than before. Again, due to stress, which is a very important factor because it leads to chronic inflammation in the brain. So when I say chronic, it is long-standing inflammatory state of the body and brain. So the सूजन जो कहते हैं, microscopic level की सूजन, in maybe starting from feet, in showing on your face, in your brain. So that mild, long-standing inflammation is the cause for degeneration of the brain going ahead. So that is becoming more common these days. For lifestyle, food patterns, exercise. So what exercise has done over years, it has, so अपने गाड़ियाँ हैं, escalators हैं, we don't need to move anymore. Same thing is now happening to the brain. You don't need to apply your brain and life can go on, you can survive without using the brain as well now. As time is passing, with technology and everything to assist you. But I think these technologies are, I'm very afraid of these things. I don't use it on myself so much. So I would advise to, apply your brain, apply your muscles. These are for free, but they are not for free. They come at a cost of your own health.
Thank you very much.
I think we'll just take one more question.
Thank you very much. First, I would like to thank Guru Nanak Medical Plan and the team of doctors for this seminar. Thank you very much. It's very educative. My question is to Dr. Sahib Pangani. I understand that shingles are related to nerves. I had shingles 4 months ago. My nerves are still not very much settled. And I can say they are a bit of anger, the angerness of within the nerves is still there. And what are the side effects of shingles? That's my question.
Right, so to simplify your question so that everybody can understand, shingles is herpes. So herpes जब कहते हैं तो पानी भरे हुए छोटे दाने चमड़ी पे अलग-अलग रीजन में निकल सकते हैं. So that is herpes in adults. Herpes in children is chicken pox. वही चिकन पॉक्स बड़ों में होता है तो उसको herpes का ये shingles का फॉर्म कहते हैं, zoster, herpes zoster. So number one, I think vaccination is a very, very important and an effective way of preventing shingles. Everybody above 60 years of age should take it. I personally recommend that. My parents have taken it and it's guidelines world over in many countries. Above 60, one should take the vaccine for 2 reasons. One thing, prevention of the disease itself. एंड सेकेंड थिंग, अगर शिंगल्स हो भी जाए तो उसके बाद की नर्व की जो इफेक्ट है वो काफ़ी हद तक कम रहती है और रिकवर जल्दी कर जाती है. सो प्रिवेंटिंग दैट इज़ अ वे मोर ईजियर एंड इम्पॉर्टेंट आस्पेक्ट टू दैट. नंबर वन, अब हो ही गया है तो व्हाट कैन बी डन फर्दर. तो जनरली टाइम के साथ 4 months हुए हैं तो इट स्टिल कीप्स गेटिंग बेटर विद एवरी पासिंग मंथ एंड देयर आर फ्यू मेडिसिन्स टू असिस्ट दैट रिकवरी एंड हीलिंग ऑफ द नर्व्स टू इम्प्रूव दैट.
Side effects?
Side effects of shingles, जो आपको जो पेन रह जाता है नर्व्स में, पेन या झंझनाहट या नमनेस जो वो रह जाता है, that is the main side effect. Uncommon cases में, I mean, it can affect other organs like lungs, liver, sometimes brain, more importantly. क्योंकि नर्व्स से ही ट्रैवल कर ब्रेन में जाता है कभी-कभी, but these are uncommon. So for a common use, I think mainly pain, झंझनाहट जो रह जाती है पीछे से, that's a common side effect.
I want to add one more thing. In the zoster, especially herpes zoster, after once you have that episode, you should avoid too much of stress. Many times, patient having so much of stress and they're taking too much of sympathetic stimulation, they again reactivates. So the pain is again going in the down and severity of pain along associated with the stress also.
Is there any side effect of this vaccination?
By and large, no. It is quite safe. 1 or 2% side effect तो हर चीज़ में होती है. But if you compare the benefits versus the risk, it is a huge difference. So I would quite recommend, because it's internationally recommended in most of the guidelines as well. So it should be taken.
Thank you.
Okay, I think because of time, we will move on. But thank you all for participating. What we have recognized and what is encouraging is people want to know about different conditions. I can tell you for sure that one session is not enough to discuss these conditions, but what we can do is arrange for subsequent sessions on the most common disorders and things that are life-saving to recognize and seek urgent care for. That is going to be effective. That is going to be helpful for our community. So I'd like to once again thank you for all the speakers. In case you have any questions, I think they're still around during the lunch break. So feel free to sidebar them and get their contacts so that ongoing conversations can continue. So with all the discussions we've had today, I think one thing is clear, that there are numerous conditions and patients can present in different ways. One thing that is also clear is healthcare is increasingly collaborative. You can see they have a team, we all discuss and consult with each other. It's no single doctor, no single specialty, no single hospital even at hand. There are things that require urgent care here, like stroke, where time is brain. There are things that if there's difficulties and there's that capability of going elsewhere, that arrangement can be done. So what I wanted to touch about is, you've heard healthcare extends beyond just diagnosis and treatment. It's a very dynamic sort of field. It involves planning, understanding available options, being financially prepared, also having the right support systems in place, knowing how each of this happens and is coordinated, from referrals to travel arrangements. Insurance coverage and even continuity of care can make an enormous difference, especially during challenging times where a condition is presenting. One thing that is essential and is really important is health insurance. Health insurance is one of those gray areas that many of us are trying to also figure out daily. They're basically, in definition, sort of contracts where you pay amounts for coverages of medical expenses that might be presently or might come up unexpectedly. So it saves you from catastrophic, out-of-pocket expenditures in situations where you might not have those resources. And we need to understand health insurance further. We need to really know the different plans we have so that we carefully choose. And that, I'm sure insurance representatives are going to explore on. But we need to know what is inpatient cover, outpatient cover, maternal care. We need to know how even chronic and pre-existing conditions are covered. So there are many plans, but what I'd like to encourage our members is, we also have national plans that are being implemented. They're evolving, and we hope that they actually become a bit more comprehensive. But I would like to encourage that, like the local insurances, like we have the SHA insurance, please get yourself covered with it. Please have the payments done. Please also do it for the people that work with you, your employees. Encourage the people that your colleagues. It can supplement to other private insurance plans you might have, and it might not cover international services, but it can cover services here. So it's important to know that. So today we have two representatives from CSI Insurance Brokers and also JA Insurance. They'll talk more about this. They'll talk about the plans they have. So I would like you to, first of all, warmly welcome Jane from GA, who will talk about the plans, and then subsequently Gladys from CSI, who will also talk about the plans under them. So welcome, Jane.
Good afternoon. So here is today CSI is here. We are here at the East African Ramgarhia Pangani to explore our partnerships with CSGVP Hospital to promote medical tourism and see if we can have accredited-based services under the Hindu Council of Kenya medical scheme, just like the local providers we do here. And we hope we will go. And I hope I will say it correctly. We're Helgrity Culture, we're Helgrity, but I hope I got it right. Yeah. So we can talk, I can give us more history. We also have our other colleagues. Farista and Maureen, just come front please guys, because Farista from G is the one who is there, who is involved with providers. Any provider is to be empowered on the side of G insurance, Farista handles the same. Can give them a microphone. Farista, just say what you do at G Insurance, being the insurance company.
Hi, good morning. Is it afternoon already? Yeah, afternoon. Yeah, my name is Farista. I work at G Insurance. I take care of onboarding providers. I believe there must have been a communication around between SGVP. Yeah, so in case of any inquiries, I know the platform you're able to reach out to for more advice. Thank you.
Good afternoon, everyone. My name is Maureen Acheng. I'm Head of Business Development at CSI Brokers Limited. Happy to be here. Nice to see you all. Thank you.
based on the forum of this, we had prepared something small, a presentation that is overseas treatment, claims, and medical risk management. I can display that. We can see our point number 1 is overseas treatment planning, where we are talking about gradation, like the hospital we are talking about, SGVP hospital, which is a accredited one, and we appreciate that. Complication, we can go, but I would like to go straight to the sub-benefit of pre-existing conditions. When we talk about the pre-existing conditions, in case you're on any medication, that is, we are talking about the daily medication, you are supposed, when you are taking an insurance, you are supposed to declare, don't hide anything. Because we always say you have to have the utmost faith. And then this reads, if you hide anything or you don't declare anything, your claim won't be payable. That's the insurance policy and conditions. Then I just want to recap in a nutshell, coverage of the remits, where we have, you'll find all the local insurance we have here in Kenya. There's no, all the pre-existing conditions, they are capped to a certain limit depending on the full inpatient limit. For example, if you're on a 2 million, on the scheme here, we are talking about Hidukans of Kenya, you'll find if you're on a 2 million cover, the maximum benefit you can get under the pre-existing condition is 600. I know you'll come and ask why. It's because pre-existing conditions, they are being managed and they are not full in according to your inpatient treatment. If you're on a 3 million, 5 million, 10 million, there's always a capping of that. And we always advise members to seek approval before you access treatment, whether local or overseas. For example, because we are the handler of the Hidukans of Kenya scheme, I know 80% of people, they like accessing treatment in India. And we are always assisting on that and guiding accordingly, and also the requirements, where nowadays it's very important to bring all the inpatient bills. And something started in this year. There's something all of you know here nowadays, we have something called e-teams. Now in India, it's called GST number. You have to make sure your bills, they have that number nowadays. They are being assessed because of the KRA regulations here in Kenya. That proves the documents are genuine. Also doctor reports, discharge summaries, test results, everything, and the proof of payment. And if you don't understand, we are here to guide you 24/7. I know committee, the one who handles the scheme here, they know I'm available 24/7. My number can even be circulated even here for everyone to access it. I don't mind that. Anybody can have my contact. Then, as we always emphasize on encouraging the members to seek approval before you leave. Because you know whether your claim will be capped or not. That is very important. Also, further we have, this is the medical risk management. Emergency evacuation, language barriers. Like me, you take me to India, I know I have a language barrier. Local regulations, like the way I was telling you, bringing bills with GST numbers. Financial fatality, all those. Then here we come, I've made a summary of the scheme sub-benefits. Where you see pre-existing what I was talking about, 250, under 5 million, 2 and 3, we have 607, 5 million, we have 700, 10 million cover, you get a 1 million. Then we talk about the cancer. All the capping, These are the quotations which are cut, they are not paid in full. I don't know, so far, do you have any question? Then the key points is case-by-case assessment. Each treatment case is assessed separately because different surgeries have varying rates authorized by the Kenya board here, which is adopted by all medical underwriters. Preferred providers, members are strongly encouraged to prioritize in-house. This is about the logo cover here. The in-house doctors, as private doctors, charges are a bit higher compared to the board rates here in Kenya. Because in case it's above the authorized limits, the member always there has to pay out of the pocket. Pre-forwards, like what I mentioned earlier, that you have to take approval before you're accessing your treatment, especially the planned surgeries. Overseas treatment, please be advised that for any treatment sought outside the country, we require prior notification, a copy of doctor's medical report, and once it is received, you get the instant approval from the insurance company, which is G Insurance. Next, I'll talk about the travel insurance for those who are traveling to overseas. We have a rider cover by the name of travel insurance, which comes in handy, where it even medically it covers both outpatient and inpatient. And I'm talking about annual cover, where you see those people who are within the age group of 19 to 65. The total premium is $372, equivalent to 49,000 Kenyan money. The next age group, 66 to 75, equivalent Kenyan money, it is 73,000 because of the age. And this cover, with this, you can travel anywhere in the world, as many times you want, provided the trip maximum, each trip you are going is not exceeding 92 days. And in medical terms, you are entitled to 225,000 USD. The only thing is not covered under travel insurance under medical, it's any pre-existing or chronic conditions. This covers the rest of emergencies, including out and inpatient. And it's a very important cover. The pricing, if you don't want to take the annual covers, we have prices for short period if you are going for 1 week, 2 weeks, and it's very affordable. Like if you are going to Europe, for example, for 2 weeks, you only pay less than 3,000 Kenyan money. And it covers the benefits I was talking. Like in Europe, you are covered $80,000. Everything is in dollars when it comes to travel insurance. But if you find yourself, you travel so many times, we advise the annual cover, which is affordable. That's the continuation of other benefits under the travel insurance, medical. We also have about flight delay, baggage, lost baggage, such things. Then, when it comes to the scheme, we have done so many comparisons, including because from the current medical scheme we have another medical underwriters. You see this one for Hidu Council of Kenya, the benefits are higher compared to the rest. And let me ask my colleague.
Good afternoon. My name is Jane, G Insurance. I am your underwriter. That's the time you propose you want to have a medical cover. It's me who makes sure that your name is activated, who makes sure that your benefits are correct, who makes sure that when you are hospitalized, pre-authorization is done on time. So to emphasize on benefits, the benefits you choose, you can see the CSI benefits. Some of them are as per the age. If you are above 81 years to 100 years, we still accommodate you, but at a fixed benefit of around 500,000. And so far, so good. We do not have much issues. It's a scheme that is well organized, and we are proud to be associated with you. Thank you so much.
Okay, so other than the Hindu Council of Kenya, which is the product Gladys is running with GA, allow us to introduce the CSI family to you guys. So CSI stands for Complete Solutions Insurance Brokers Limited. We are one of the leading composite insurance brokers in Kenya. We operate in East Africa, Zambia, and South Sudan with partners. With over 33 years in the insurance industry, we've transitioned from underwriters to trusted brokers specializing in consultancy and risk management. For over a decade, we've provided seamless, client-centric insurance services built on integrity and professionalism. At CSI Brokers, we are more than an insurance broker. We are your strategic partner in managing your risks. Our client retention rate currently stands at 95%, which shows about our services. We are of course regulated by IRA and Data Protection Act, and for your medical schemes, we are MIP registered by IRA. What do we bring, or what is it that CSI brings to your table? So at CSI, we are your guardians of interest. We do have impeccable record keeping, so at any given time you request for a report, you'll definitely get it from Gladys. We do comprehensive claims management, so before we come back to you, we'll ensure that no stone is left unturned. And then we have seamless transition of previous claims, just in case we are onboarding you on the other side, that is not medical, and you had pending claims, we ensure that everything is seamless for you. We do proactive policy review, which for the Hindu Council of Kenya, it's being done by Gladys and the team. And also we do comprehensive brokerage services. So at CSI, we usually say that we bring the 7 C's to our clients. So the first C is consistency. So Gladys is consistent in your scheme. Wherever you go, you'll always find Gladys in the team. Then we do continuity. She's there always, not that we are changing people for you. Then at the back, we have a full support, and we have the capacity to ensure that you get the best services. We are also capable to ensure that all your insurance needs are sorted with us, and our commitment is on another level, and that can be attested with the products that we run as CSI. Claims settlement is key for us because that is what speaks for our services. And the last important C which we usually have is the CSI way, which all of you should test. Thank you so much for your time, and we look forward to more partnerships with yourselves. The floor is now open. In case of any questions, we'll be able to address from here.
You got the question? So you spoke about travel insurance to Europe. So what I'm asking is, does it cover Canada and the US?
Yes. The cover I've given, I've shown on the screen, it's worldwide cover. Or I was just giving you, if you're only taking a cover to Europe only, the Schengen countries. That's why I was telling you the remit, like for medical is $8,000. But you go to USA, you have a cover of 225,000 USD. And the rates I gave there, worldwide, anywhere in the world. When you take that cover of 49,000, you can go to any country. And in case you get stuck, WhatsApp is open. We have a WhatsApp number which is open 24/7. Yeah, and you can reach us. We are going to guide you. If you feel you want to go to the accredited hospitals there, or you choose to go to your own preferred hospital, maybe your relative is guiding you, we will advise you, keep all the documents and come and bring for claim settlement. You'll get your refund. The best thing with the travel insurance, even the claim, you can report it after even 6 months. Yes. That's the best thing with travel insurance, because you are not covered by a local company, you are covered by an international company. Those are the ones who pay your claim. Yes. Question at the back.
My question is, you mentioned in the travel insurance, chronic diseases are not inclusive when something happens abroad. But like, let's say someone is a diabetic and he gets a diabetic attack overseas, and you're not going to cover for that.
Yes.
Yeah. But
Yeah. The travel insurance excludes chronic conditions and complexity. That's why now your medical insurance will come in.
But then, like, would the medical insurance cover that? Could you claim for that later on with the medical insurance now?
Yes. You have a local cover for your medical policy, it will be covered.
No.
And immediately we are going to guide you, especially if you are at this cover for Hindu Council of Kenya. We are going to give you the requirement. The local policies here in Kenya, they exclude USA and Canada. So if you go to Canada, the cover might be excluded.
My second question is to GA. Maybe the lady can answer that. What happens, for an instant, I've got a procedure to be done, and you need to do this XYZ test before the procedure. All the tests are being paid by cash, which GA does not cover. It is only the surgical part that is going to be approved or may not be approved, I don't know. But 70 to 80% of the cost has already been paid in cash.
Felista, are you able to answer that?
And it is only the 20 or 25% cost that is going to be paid by GA that is the actual surgery now. Now, what happens? Like, you got a procedure, you're ill. Something, let's talk about heart disease or anything. The cover only covers inpatient. Yeah? When the doctor requires you to have XYZ results to be done, there is what we call an investigation, which GA does not pay for it. Yeah? And that is the major part of the whole entire procedure. That's the 70 to 80% of the cost for even doing the surgery. Surgery is only at 200,000, but the major part is the investigation. that should be considered.
Hello, hi. Maybe just to answer your question, I believe you're talking about you having a medical cover already, and basically, let's say even if you are seeking treatment locally, your cover road is only inpatient cover. So again, that's why it's just self-explanatory. Like as much as you will need to get some outpatient, like the investigation, consultation, and everything. That excludes, because again, your cover only caters for your inpatient services. Maybe that's why, again, you will not be able to get reimbursed for the outpatient expenses. Unless maybe now, okay, something maybe can be picked up by the brokers and the community to discuss it, because again, you know, the expenses we are covering are the ones that you pay premium for. That's why you find it's a bit difficult to go again and pay for something that has not been insured.
Any further queries, we have the desks outside.
Okay, great. Yes. Because of time and the sensitivities to, like, you know, the expansive talks, we can direct any other questions to the respective desks for the insurance questions. You can go to your desks. Thank you. So thank you CSI and J Insurance for that. Please feel free to visit them at the back. So you've had a lot of conversations today about different conditions, insurance. You've seen the dynamic nature. You've heard about risk factors, protective factors. Please keep them in mind. So now, just to hand over, I would like to now invite the Guru Nanak Medical Plan Committee Chair to give a vote of thanks. So, welcome, Mr. Sami.
Thank you, everybody. As we come to the conclusion of today's program, it's my privilege to extend our heartfelt gratitude to everyone who has contributed to making this event a resounding success. A special thanks goes out to each and every participant who took time out of their busy schedule to join us today. Your presence, active participation and thoughtful questions have made this program both meaningful and impactful. We sincerely hope that the knowledge and insights gained today will inspire each of us to take a proactive approach towards maintaining our health and planning for our future healthcare needs. After all, good health is the greatest wealth, and investing in it today can make a profound difference tomorrow. Once again, thank you all for your participation, support and encouragement. May Vaheguru bless you and your families with good health and happiness, peace and prosperity. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.
So now I'd like to invite the President or Chairman of the EARB committee for their closing remarks, as well as just awarding our speakers with a token of appreciation. So welcome.
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.
First of all, I would like to thank our Guru Nanak Medical Plan team headed by Jasraj Sami for organizing this seminar, and you have put in a lot of effort to make it a success. We had a very little or small gathering in the morning, but now the house is nearly full. I would request everybody, when we have in future such events, your participation is very important. And then on behalf of my trustees and Board of Governors, I thank all the doctors for coming all the way from India to give us the insight of the SPGP hospital, and your presentations were insight, and we have learned a lot of new technologies which are not offered in this country, and we thank you wholeheartedly for coming to this one, to our country in Kenya, and explaining what services you are providing. Thank you very much.
Quite the interactive forum today. They say gratitude is best expressed through action. As a small gesture of heartfelt appreciation, we would like to present tokens of appreciation to our valued partners, guests, in recognition of their unwavering support and commitment. May I kindly take this moment to invite our team from SGVP Hospital, Mr. Goyani, Dr. Betai, Dr. Patel, and Dr. Dev Murari to the stage and receive the token of appreciation. That we also invite the Governing Council, Mr. Surinder Singh Sira, Mr. Kamaljit Singh Sira, Mr. Maninder Singh Matharu, and our trustee Manjit Singh Teti and Jaswinder Singh Virdi to stay on stage to give our distinguished guests the token of appreciation, please. And our GNMP medical team, please. Mr. Muddar, Mr. Sagu, Mr. Rupa, Mr. Chana. Next, thank you team SGVP. Okay, now I understand the SGVP shall be presenting the award. you so much, Team SGVP. Now we would like Felista and team. Felista, Felista, we'd like to invite you on stage to come on, to receive your token of appreciation. Yes, thank you. And now for our Master of Ceremonies, Mr. Chan. We'd like to appreciate our Master of Ceremonies, our very own Dr. Pavan Singh Chana. One last time, we'd like for the Master of Ceremonies, Mr. Dr. Chana, to conclude the program for today. Thank you so much for your patience. We really appreciate it.
Thank you for the award. And thank you everyone once again for attending. We really are graced and honored for you sacrificing your Sunday mornings and early afternoons. So as you've seen from the session, considerable efforts are being made to continue to improve access to affordable, high quality healthcare in various realms, including locally and internationally. It is our collective hope and indeed a shared responsibility that we continue to support such initiatives to strengthen the healthcare for our communities. Hopefully one day we can also set up such hospitals, and that's our hope and prayer in our own country, where we can also have such specialists. But for now, these referral pathways are being set in place. So as you've mentioned, as the speakers have mentioned, there's tremendous advancements in medicine, and yet the most important things are life beyond, life prior to these conditions coming up. So you've heard many of the speakers mentioning that prevention, vaccination, regular exercise, good nutrition, healthy lifestyle, strong family support, and communities that care for each other is utmost importance. So I'd like to encourage you all to keep that in mind. I'd also like to encourage you all that today's seminar does not end here. Please continue these conversations with your families. Schedule your regular health checkups before conditions arise. Review your insurance covers. Seek medical advice early and timely and appropriately. And on behalf of the Guru Nanak Medical Plan Committee, the speakers, thank you for making this event a success. So now we warmly welcome you all, everyone who participated for lunch, our Guruka Langar. Please continue these conversations at the desks. Please reach out to any of the faces you've seen in front. May Waheguru bless you all and your families with good health, happiness and peace. Sat Sri Akal.